Students, today we are going to discuss about patient counseling. Let us understand first what is patient counseling. It is providing information to patients or sometimes to their representatives regarding the disease, the drug therapy, duration of the therapy, side effects, and what modifications need to be done in the lifestyle. Now, why do we need patient counseling? Because sometimes there is a lack of sufficient knowledge about various health problems. Not only about that, but sometimes there is a lack of knowledge about the medication also, because of which there may be sometimes a non-adherence to the pharmacotherapeutic regimen, and therefore even sometimes there may be a problem in monitoring of the entire plan. So pharmacist can play a very important role by counseling the patient, because he has an entire knowledge about the drugs and the medicine, plus he can acquire those skills with the help of which he can convince, educate and counsel the people to adhere to his regular therapeutic regimen. So that is how we can improve the patient adherence, and we can also reduce certain problems which are related to the medication. Hence, a pharmacist can perform two roles. He can either educate the patient, at the same time he can counsel the patient. He can do these activities either with individual interaction to the patient, or by having the groups of the patient, or giving the information to his family members, or sometimes to the caretakers. So let us first understand what is the difference between educating and counseling. Educating is something where not necessarily the population to whom you are educating did not suffer from any disease. So it is a type of preventive in the nature. It foresees the potential problems. It prepares the learner ahead of time with possible scenarios and what can be the solution if those problems arise. It has more to do with now, why and how the things are going to work out. It can be given in a formal setting among the group or individually as per the requirement. What is the counseling? It is after the fact. When a patient is suffering from any disease and he is on any medication or a therapy, then you need to counsel for a proper use of the medication to avoid side effects, to avoid drug interaction, adverse effect, so that reaction to the occurrences and negative situations which are likely to occur can be corrected, or they can be altered, or they can be changed. It is given more on an individual basis in a private setting. So have you understood the difference between educating the patient and counseling the patient? Today we are going to discuss about counseling of the patient. It is providing information to patient and their representatives regarding disease, drug therapy, duration of therapy, side effects and lifestyle modification, which I already told you, but I am repeating it here again. Let us understand what are the objectives of the patient counseling. Why are we performing patient counseling? So that the patient should recognize the importance of medication, how it is important for his well-being. Even it helps to develop a working relationship. It forms a foundation for continuous interaction and consultation, and therefore a good customer relations can be established. The patient understanding of strategies to deal with medication, how he has to deal with side effects, how he has to deal with drug interaction, how he can avoid those drug interactions. So patient will understand that and should ensure the better patient compliance. Once he understands his entire therapeutic regimen, he will always try to adhere to it, and he will always take those precautions to avoid any ADRs or the drug interactions. Another objective of the patient counseling is that patient becomes informed, he becomes efficient, and he becomes an active participant in the treatment of the disease. Not only that, but if he is educated properly, he can take his own care. So self-care management is possible. The pharmacist should be perceived as a professional who offers pharmaceutical care. so that when you do a patient counseling, the community understands a proper role of a pharmacist as a healthcare professional. Drug interactions and adverse reaction can be prevented is the most important advantage of the patient counseling. Let us understand, when you do a patient counseling, what outcomes you are going to get. Patient recognizes the importance of their well-being. That is very important. It encourages the patient to establish working relationship with a pharmacist and foundation for continuous interaction. It improves the coping strategies to deal with side effects and interaction. It motivates the patient to take medicine for improvement of his or her health status. The patient gets informed, efficient, and become active participant in the disease treatment and self-care management. He develops the ability to take appropriate medication related decisions concerning the compliance or adherence to their medication regimen. So these are many beneficial outcomes which can come out. So when you start the process of the patient counseling, what are the steps involved? The first is introduction. Then what material or what is going to be the content of your counseling, exactly how the process of the counseling will be executed, and ultimately what are going to be the concluding points out of your entire counseling exercise. So the pharmacist should be well prepared before and should give a thought to all these points. Let us understand first introduction. Introduce yourself as a pharmacist. That creates a confidence in mind of patient that some educated health professional is going to instruct him or her. Explain what is the purpose and expected length of the session so that the patient is already well prepared to listen to you for that much duration. Obtain the patient's agreement to participate. It should not be a forceful. If there is a willingness of the patient, then only the two-way communication is possible. Assess the patient's first knowledge about his and her health problems and medication. Does the patient know from which disease he is suffering? Does he know which all medicines he has to take for treatment of that disease? Is he aware of the names, brand names of those disease, frequency of administration? Even try to understand what is the physical and mental capability to use those medications appropriately. Are we dealing with small children? Are we dealing with elderly patients? What is their physical status? What is their mental status? Are they in a state of understanding and grasping your instructions? Everything needs to be seen, observed, and studied. And very important, attitude. What is the attitude of the patient towards his health problem and medication? Does he really concerned about his health problem? Does he really want to take the medicines? So that needs to be understood right in the beginning. A patient sometimes may lack a visual acuity to read the labels or the prescription containers, or sometimes markings on the syringes, or sometimes even the written handout material. Some patients may be unable to hear your oral instructions, so you should take care of that. You should be planned for it. They may lack sufficient motor skills to open child resistant containers. So then you have to demonstrate them, or you have to suggest them the proper alternatives. So your skills are very important over here. Your communication needs to be very effective. You should ask open-ended questions. Not only that, but when you are talking with the patient, you should develop the skill of active listening. You have to develop those language skills and adapt messages to fit the patient. You may not use some scientific terminologies which patient may not understand. So you have to simplify them and explain them in the layman language. Observe and interpret non-verbal messages when you are communicating with a patient. Like, is he keeping eye contact? Is he hiding some information from you? His facial expression, is he really listening to you? Is he really interested what you are telling? His body movements, his vocal characteristics. So you have to even learn the body language of the patient. Review the patient record then prior to the counseling. Understand what is his entire medication history. Conduct an appropriate patient counseling introduction by self, as well as you get the introduction from the patient also. Explain the purpose of counseling session. That is very important. That why are you conducting that counseling session? Then only the patient will try to listen to you. Obtain pertinent initial drug related information, like has the patient suffer from any allergies, is he on the treatment of some other medications other than what prescription you are going to discuss with him. Warn the patient about taking other medications including some OTC product, or he is taking some herbal drugs, or he consume alcohol, which may inhibit the effects of his current therapy or may lead to certain drug interactions, or sometimes maybe there are ADRs due to these interactions with the prescribed medication. Then during the discussion you ask some questions, counter questions, so that you will come to know whether is patient listening and is he understanding the reason of the therapy, why he has to undergo that therapy, has he convinced, has he understood. So that is what feedback you need to take from the patient. Assess any actual or problem of importance to the patient which he may not have disclosed with his consultant or the doctor, and that is creating a hindrance in the adherence to his entire medication. Try to get it, or try to make the patient open so that he will try to explain you what are the problems for his non-adherence to the treatment. So very important is that always ask the open-ended question, as I am repeatedly telling you, about medication purpose and what the patient, and very important, that what are the expectations of the patient from you. Ask the patient to describe, or sometimes you can ask him to show how she is going to use that medication. Or they should also be asked to describe if there are any problem, concern or uncertainties which they are experiencing with their medication. They may not have disclosed it with a doctor, but if you are personally asking them in a confidentiality, maybe they will open up. Provide information orally, but sometimes patient attention span may not be that long to be continuously attentive throughout your discussion. So in between you may have to use certain visual aids, you have to perform certain demonstration, so as to fill the patient's gap in the knowledge and the understanding. He may have a knowledge, but he may not have understood that how correctly that medicine has to be taken, and that can be achieved with the help of certain visual aids, or that can be explained very well with the help of the demonstrations. You open the medication container, show the patient what are the color of the tablet he is supposed to consume, what is the size, what is the shape, what are going to be the markings on the container or the oral solid dosage form, how is going to keep and monitor his therapy. So demonstrate. For oral liquids and injectables, you show the patient the dosage marks on measuring devices. Demonstrate, sometimes the assemblies are used like inhalation, nebulization. So use of administration devices such as nasal or the oral inhalers. You have to demonstrate how properly it has to be taken. Then becomes the what are going to be the contents in your counseling after the introduction. Discuss the name and indication of the medication. Explain the entire regimen of the dosage, including what is going to be the total duration of the therapy, and that is going to be appropriate. For example, you are suffering from respiratory tract diseases. Now when you are suffering from respiratory tract diseases, antibiotic therapy is there, and he has to complete that entire antibiotic therapy of duration 5 days. Only after feeling well he cannot give up that therapy. You have to explain what are going to be the possible side effects of it. Explain how long it will take for a drug to show. Some drugs may not have a prompt action. They may have a delayed onset of the action. So you have to tell the patient that he should have some patience, and the effects will begin to occur after certain period. So you have to tell the patient, you have to show him, you have to explain him in that matter. Not only that, even you have to discuss about how he is going to store that medicine, or if he has to do the refilling of the container, how he's going to go, where he has to go, how frequently he has to go for refilling the, so entire refilling information you have to give. Emphasis the benefit of completing the medication as prescribed. If he completes the entire therapy in a stipulated period, how his health is going to get benefited. Discuss the potential side effects. As you are explaining him the benefit of the therapy, at the same time you have to explain him what are going to be the side effects so that he can deal with those side effects. Discuss how to prevent and manage those side effects of the drug so that his therapy becomes tolerable. Discuss the precautions which he has to take, what he is supposed to not take along with the medication, which diet he has to take, which herbal or OTC product he has to prevent taking along with their main therapeutic medication. Discuss the significant drug, food, drug alcohol, drug disease interaction, drug laboratory test interactions. Explain precisely what to do if the patient misses any dose. That is of great concern for a patient. Explore the potential or any other potential problems which are associated with a patient. Now, in the process of the counseling, use the language which patient can understand. That is very, very important. Use the appropriate counseling aids. Present the fact and order in a very logical order. Use open-ended question and use both verbal as well as the non-verbal behavior. If the patient is experiencing problems with his or her medication, then you are the one who will gather the appropriate data, you will assess that entire problem, and you will adjust his entire therapeutic regimen according to the protocol. If that is not allowed in that particular setup, then you have to notify what modified therapeutic regimen can be prescribed to the prescriber. The medications, trade name, generic name, common or other descriptive names, and its therapeutic class, and what is going to be its efficacy, all these things can be discussed with the patient. The medication use, expected benefit, action, and what is the intention of giving that medication, to cure a disease or to eliminate or to reduce the symptoms or arrest or slow the process of the disease or to prevent the disease or a symptoms. So you make it very clear to the patient that what is the purpose of taking that medicine. The medication's expected onset of the action and what to do if the action does not occur. The medication's route of administration and what is going to be the schedule and what is going to be the duration of the therapy. Even you give directions for preparing and using or administering the medication. This may include adaptation to fit patient lifestyle or the work environment, because there may be sometimes people who are working at night, their circadian cycle may not be a regular one. In that cases, maybe you need to do certain modifications. You have to give certain instructions, special instructions to the patient. So depending upon his lifestyle and work environment, you have to suggest the medication, design his entire therapeutic regimen and counsel him. And very important, as I already told you, what action he has to take in case of the missed doses, especially in diabetic patient. And precautions to be observed during the use and administration of the medication. What are the potential risks in relation to benefits for injectable medication, administration devices. Even you have to discuss concerns about allergic reactions, and then need to be discussed what antidote or what medication he has to take if any allergy is reported. What are going to be the common adverse effect and what are going to be the serious adverse effects. What actions need to be taken to prevent or minimize their occurrence, and how immediately he has to notify about their occurrence to the prescriber or the pharmacist, to other healthcare providers. And very importantly, what techniques he can use. What are the different techniques, apps or technologies available for the self-monitoring of the pharmacotherapy. Then very important, you can even discuss what are going to be the potential drug-drug interaction with OTC products, interaction with food, interaction with disease. So what are going to be the contraindication. even the medication's relationship to the radiological and laboratory procedures. As I already told you, what are going to be the proper storage of the medication, what is going to be the very important proper disposal of the contaminated or discontinued medication or administration devices, and any other information which is unique to that individual patient or unique to that particular medication. So, what are the different steps now involved in the counseling? Verify understanding via feedback. Now you come to the end of the counseling after giving so much information to the patient. And now how will you conclude your counseling session? You have to verify first that has the patient understood. So you have to take a feedback. You can ask some questions, or if the patient is not able to sit at the place for a longer period, then you can send him the Google Forms, or online you can send him the question and try to get the answers. Summarize by acknowledging and emphasizing a key points which he has to adhere of the entire discussion. Provide an opportunity for the final concerns or questions. Even if you are concluding, you allow him if he has any doubts in his mind and get it clarified and clarify those doubts. Help the patient to plan. So after counseling session, your duty is not over. After that also you have to do a follow-up. That is very important. And you have to decide what are going to be the next consecutive steps. Help him to plan, self-monitor. Verify patients that which we are already done with it. So today I will stop over here. I have explained you the entire processes of the patient counseling, and in part 2 we will see what are the barriers and what are those barriers and the ways, how are the methods, which are the methods with the help of which we can overcome those barriers. Thank you.